I'm fortunate, I'm blessed to be here. I never knew that CFI even existed.
There's no weakness here. No one has sympathy for you here. Everyone's just like you.
When you share the same adversities and you go through the same things, it kind of makes you like a brotherhood.
I've never been here one day and seen somebody in tears. Never once. Even though you lost limbs, even though you've been shot with the 45, even though you bled out, all those things, I've never once seen that. Because everybody is here for you.
Amazing is, there's just no better word to describe the facility, the staff.
The doctors, they're your friends. You create relationships with them. I've seen people when they left, almost sad that they're leaving. Happy that they've recovered, but sad that they're leaving.
I might be missing all 4 of my limbs, but it's not a loss to me.
You realize that it's not the end of the world, and you can continue. You can have the same quality of life that you had before. It just takes a little more hard work, and that's what they help us do here, get over that hurdle.
Well, the Brooke Army Medical Center is comprised of several elements, one of them being the hospital here, which opened in 1996. It takes over 8,700 personnel to keep San Antonio Military Medical Center in operation. It's the Department of Defense's only Level 1 trauma center, one of the 25 busiest trauma centers in the United States. This hospital, spanning 22 counties here in Texas, serves some 7 million Americans. Meanwhile, Kevin has made his way over to the center for the Intrepid. Kevin?
Hannah, welcome to the gym. This is where we go next level for many of the wounded veterans. We're going to start here at the anti-gravity treadmill. Now, check this out. It is a bubble. It allows partially weight-bearing patients to immediately work out. You see it filled up right there. If you need a prosthetic, this is where you go, the office. You get fitted for one. What's special about this gym is immediately you could test it out on the platform, the elevated platform. Only 3 sets in the world. 2 of them are in this building. You notice the natural sunlight coming in from the high windows? The whole point is comfort. They want to soothe the patients and the many athletes. You make that transition to the next gym, you already get it here. If you want to be challenged, how about climbing the wall? This is next level for many of the patients. We're going to come down here further. Zoe, our service dog as well, helping things out. The Biodex machine. This allows doctors and therapists to understand the strength so you can build that progress. To the right of it, normal weights. This is still a normal gym. We have athletes all around us. And of course, a gym wouldn't be complete without a rim and a basketball net. One thing that really stands out, though, is on a daily basis, you have access to your doctors, access to your therapists, and access to psychologists. We're here in the fabrication room with the Chief of Prosthetics, John Ferguson. This is where prosthetics are born.
That's right. This is where everything changes. It all starts happening down on this floor. And if you look at where we're going now, earlier today, this was a mold that was taken of someone's leg that's going to be fit with an IDEO over this week. And if you see right here is the next stage where the mold will be modified. We still use very older traditional techniques in terms of everything needs to fit perfectly. We do everything by hand at this stage. None of this part is automated. We can get the exact fit that we want. We can get the comfort that we need. We can get the rollover shapes that we're looking for. So really the biomechanics are born right here that will end up with a successful outcome that you'd see up on the 3rd floor.
So we're sculpting the plaster right now. Then what's next?
After that is completely done, the mold is all finished, then we move down to the vacuum forming room.
Okay. You see several models of past patients on the shelves as we are now outside the vacuum forming room. What's inside here, John?
Well, in here is where we do the high temperature vacuum forming. We have the finished mold right here, and now the plastic is heated in the oven from a sheet form. It's placed over the mold, formed all the way around from the top to the bottom of the mold, and once he has a complete seal on it, then he'll apply vacuum. It'll be trimmed so it seals properly.
How hot is this plastic right now?
This plastic is, this is about 350 degrees, and it takes about 12 minutes to prepare. And then once he has it all cut, he'll apply the vacuum. And the hot plastic is pulled against the mold, giving us a complete duplication of the work that you saw in the plaster area.
John, almost done. What's going on in the machine room?
Machine room is where everything gets trimmed out and prepared for final assembly, which you see happening on this side of the room. In final assembly, we have all various kinds of devices happening right here. Regardless of the injury level, we're here to take care of them.
All right, and here at the end is the final product, and I call this the Star Wars hand, and I love this. Now, how many have you fitted in the last 5 years?
We've had about 750 individuals get served with the IDEO bracing to this point. And a lot of those guys have gone back to active duty. Many have gone back just to active life and been given hope again, basically.
Yeah, giving our veterans a new life. John, thank you so much.